We have the pleasure of hearing from Chad Trim. Chad has been with Bonterra for nearly 6 years now in various nonprofit facing roles. In his current position as solutions architect, he is passionate about collaborating with his teammates and potential impact management users to help them better manage program delivery, measure outcomes, and increase reporting potential. Chad is currently based in Austin, Texas, where he lives with his wife and his puppy. So, Chad, thank you so much for joining us this afternoon. I want to go ahead and pass it to you, Chad. Here we go. Let's go ahead and pass it to you, Chad. Thank you.
Yeah, thanks so much, Ashley, for the introduction. Really excited to be here sharing with you all today. And really excited to get to show you the impact management system, or at least some different parts of it. So I'm gonna go ahead and share my screen here and just do a little bit of an introduction before we get into the actual demonstration, which will be the bulk of the presentation today. So as Ashley shared with you all, today's focus is understanding who Bonterra is, and Ashley shared a little bit about that already. I'll go through a little bit more, but mainly today we're going to be focusing on our impact management. You may have heard of it referenced as Apricot 360 solution, and how it relates to improvements in staff efficiency. So we want to show you all today how it can help you streamline your processes to increase staff capacity. So working in this space for the past 6 years and having some nonprofit background experience, I know that staff capacity is a very common concern. I'm hearing it from organizations, whether it be frontline staff workers, program directors, executive directors on a daily basis, that their staff are stretched thin and they're looking for ways in which to streamline those processes. And we want you today to come away with a broad understanding of what impact management can do for you. Given the time constraints today, we're not going to go through a full end-to-end demonstration, which is why Ashley launched that poll, because if you are interested in seeing more after today, we would be happy to provide you with a more customized demonstration. Because also today's demo is going to be pretty high level. We work with all sorts of nonprofit organizations and public sector entities, from housing and human services to violence survivor services, all the way over to refugee and resettlement services. So a more customized one-on-one demo will help drill into more of those specifics to your organization. So today's demonstration, the brief, will hopefully help you decide if you want to move forward with a one-on-one meeting to explore your unique needs more deeply. So Ashley started the conversation with giving you a little bit of an overview of who Bonterra is. You may have heard that name on social media or in our email signatures, or you may be more familiar with one of our legacy companies, Social Solutions, Every Action, Cyber Grants, Network for Good, etc. But as a whole, Bonterra, these are some great statistics to sort of get to know our organization and show the many areas that our solutions are engaged in, to overarching in the goal of making lasting change in the communities that we're working in and that you all are working in. So today's demonstration, like I said, is going to be focused on impact management. So this graphic lays out some of the key differences between our solution and other solutions that you may be aware of or already currently have within your tech stack. So over here on the right-hand side, this is meant to highlight very specific tracking solutions, things like EHRs or management solutions, where it's singularly focused. It might be difficult to create configuration and expansion, and there might be a big lack of knowledge share. Whereas sort of on the other end, on the left-hand side, is more generic CRM solutions like Salesforce that often require a lot of technical skills and aren't focused on the impact management space. Where we fit is in the middle of that. We're social service focused, so we only work with nonprofit and public sector organizations. So we are purpose-built for that outcomes and impact management tracking. We have best practices built in, some of which we're going to see today, but also allow for ease of configuration and expansion very easily within your organization. If you're not using any data management systems currently, don't worry, you're not alone. If you are on the far left side here using spreadsheets, Google Docs, or even pen and paper, we've even worked with a handful of organizations that use sticky note method. You're not alone. Most of the customers that I work with are coming over from essentially no solution. So what today's demonstration is going to highlight are three main areas of built-in best practices: increasing staff capacity, simplifying reporting, and securing more funding. I would be shocked to hear if any of you all aren't looking to do one of these things within your organization in the next 6 months to a year. So hopefully, even if you're fitting into all three of these, you're going to find something helpful from the conversation today. So these are the three main areas that we're really going to focus in on and dive a little bit deeper in terms of the functionality that we're going to show. So our self-service tools that help increase staff capacity, functionality that helps standardize data collection to simplify reporting, and then going to show off are two different reporting tools that are going to really help organizations like yours secure more funding, like they have with many organizations that we've already been working with. Just to give you all a little bit of proof from that, these are some of the results from a third-party audit study that was done a few years ago by Hobson and Co. You can take out any of these that you want. I'm sure at least one of these applies to you all. And I want you to think and sort of hone in on one of these, whether it's 75% less time spent on reporting or 3.5 more services delivered. And think about the impact that these would make on your organization and your staff and the work that you got into this line of work to do, which is focusing in on those in your community with the most need. So I want you to think about these throughout the demonstration today and think about what this would mean for your workflow within your organization, because these are basically the minimum expectations that we have for an organization using our impact management tool. And especially if you're coming over from pen and paper or spreadsheets, it's going to be even higher than this. Wanted to end here before I jump into the demonstration today, just highlighting some of the many partners that we have utilizing our impact management system, from Phoenix Family to Brooklyn Community Services, all the way over to First Five Riverside, a favorite of mine that I actually helped do demonstrations for. So this gives you hopefully a good picture of the full breadth of differing organizations that we work with. So going to jump into the demonstration now. And as Ashley said, I'm sure this is going to bring up a lot of questions for you all. So please feel free to jump in wherever you have questions and ask them in the Q&A box. If Ashley doesn't have an immediate answer to the question, then we will definitely have some time at the end of the conversation today to go through those and even jump back into various parts of the demonstration. So going to reshare my screen here and actually get into the demonstration. This is a good look at the impact management system. I actually always like to start on the dashboards or bulletins page. So this isn't one of the areas that we're going to dive too deep into, but just wanted you all to at least be able to get a quick glance at what logging into your system would look like on a daily basis, where you can have things like bulletin reminders, quick links to other parts of the system, and then embedded reports right at your fingertips that auto update in real time. One of the main things, though, that I wanted to start by talking about is increasing staff capacity. Again, I haven't worked with very many organizations in the 6 years that I've been here that didn't want to, in some area, increase their staff capacity. And one of the main ways that our system does that is offloading some of that data entry to either clients themselves or to referral partners in your community. So regardless of what your intake process looks like, it might be that you're meeting with clients face-to-face and doing that intake in office or out in the field, or you may have a Google form on your website where clients are enrolling in programs or filling out an application there. The easiest way to do intake within the Apricot system is through customized intake forms that you can push out to your community. You can create those custom and configured to whatever you all need to capture as part of your demographic or intake face sheet. They can be published out to your website or just exist as links that you send out to prospective clients. Whether this is filled out by a client themselves or by a referral partner in your community, it's a live Apricot form. So when it gets filled out, it auto creates a participant profile in your Apricot system that then you can go make sure they're actually eligible to receive those services and start whatever the rest of that enrollment process looks like from there. So if you're hand intaking participants currently, just think about how much time you would save by offloading some of that data entry to the clients or referral partners in your community themselves. It's very easy to create different versions of the same form. So whether you have differing questions, adults versus youth, or program to program, I always like to highlight Link, one of our partners in Kansas City, Missouri. They've got a great pre-enrollment application for their before and after school program. And they've even got it embedded in both English and Spanish on their website because they work with a large Spanish speaking population. I like to highlight Link because of the changes that they saw utilizing this. So speaking of increasing staff capacity, they were actually finding that this saved them 20 minutes per intake. So they could multiply that out by the number of participants they had referred in a given year. That was their immediate time savings. In the first year, they found that it actually saved them 85 full work days just by having that published out to their website. So I'm sure if you all are currently using the sticky note method or pen and paper, you can probably start to imagine how a form like this published to your website would make a huge difference in terms of staff capacity. Our goal, though, is to help you all increase staff capacity across a client's journey. So not just part of intake, but while they're receiving services throughout their time being touched by your organization. So whereas the custom intake forms are definitely more geared towards participants that have never received services from the organization, we actually have some additional tools that are geared towards participants that are ongoing receiving services, namely our Connect accounts. The Connect accounts is a way for your participants to engage with their assigned staff members without having to, again, be face-to-face with a staff person. You can think of this kind of like your patient portal at your doctor's office, where you can sign up as many participants as you want with their own unique username and password for no additional user cost, and they'll essentially have a pared down access to their document folder. So this is a great tool for receiving real-time updates from your clients. And our partner organizations will use this in many different ways, whether it's having them fill out pre-enrollment assessments or sending out satisfaction surveys after a client has gone through a program. This can also be used for electronic signatures, whether it's a consent form or release of information. If you need them to sign off on something, it's a lot easier to just allow them to complete it on their own time without having to come into the office and sign a paper form. This is also a tool that allows for more privacy for your clients as well, especially if you're working with any vulnerable populations, like in the violent survivor services space or foster care. It's a lot of times very helpful to allow the clients to fill out sensitive information or assessments in the comfort of their own space, being able to provide you with more honest answers because of feeling comfort around where they're filling out these surveys. As you can imagine, this tool really took off during COVID, but now has been utilized ongoing by organizations in order to maintain some of that asynchronous service delivery, whether it's services as a whole, or sometimes, like I said, just allowing them to fill out something prior to coming in for services. You don't have to give your clients access to every single form here, but rather just the forms that you would want them to fill out. It's also a great tool that we've seen organizations utilize for alumni because you can allow them to go in and update their contact information on a regular cadence. So just because they're no longer receiving services from the organization anymore, doesn't necessarily mean that you have to deactivate their Connect access. If you want to stay in touch with alumni, you can allow them to come in and update things. You probably want to lock things like name and date of birth, but could allow them to update their emergency contact information or mailing address on a regular cadence if you want to continue to send them notifications and things like alumni surveys. This is a great tool for that, and can even be used for internal staff or volunteer usage as well. One of my favorite use cases for this was a large California county that wanted a way to update COVID vaccination statuses on all staff within the county. They were able to stand this up in a couple of days when the vaccine rolled out, and within a week, they had like 95% of staff within the county upload their COVID vaccination direct to their Connect account. And all that auto-populated back into their document folder for staff to be able to view in real time. Regardless of the use case that you can think of for utilizing these Connect accounts, this also ties into the third point that I want to talk about in increasing staff capacity, and that's the ability to send out direct messages to your clients. So rather than having to utilize an outside tool for client contact, as long as your constituents have a Connect account, you can actually send out direct messages via text and email to the clients. They can be body messages like updates about events, whether they're being canceled because of weather or letting them know about a new event coming up. Those can be sent out individually or in mass to your clients. So if you have a group of clients that you want to let know about something, and you can also even send out these forms and direct message functionality as well. So a lot of times for older populations or youth populations, it might be a little cumbersome to have them log into an account to fill something out. A lot of times it's a lot easier to just shoot them a text with that form attached. They click the link, pull it up in a browser, fill it out that way without even having to log into their account. So before we switch gears and talk about the next set of functionality, just want to recap really quickly how this tool helps increase staff capacity. So throughout a client's journey, this is going to allow you all to offload some of that data entry to clients or referral partners in your community. Through the intake forms, when you're first coming in contact with a participant, all the way through them being an alumni of your services, we want to give you all the ability to cut down on the amount of time that you're having to spend keying in data into a system like this so that you can focus more in on that actual face-to-face interaction with those clients. Just think, if you can have them fill out an assessment prior to coming in for services, you don't have to spend 15 minutes of your case session with them filling out that assessment. You can spend that extra 15 minutes talking about the assessment that you already received and were able to review ahead of time. The next point I want to talk about is simplifying reporting. One thing that I hear from a lot of organizations is it's extremely hard to report out on data when it's tracked in very different ways across the organization. So program to program, caseworker to caseworker, if no one is tracking the information in a similar manner, it can be very hard to then pull out that information for reporting purposes. You might have case notes that are just an open text box or Word document where caseworker A could be documenting that information totally different from caseworker B. Whereas you might have an individual service plan, and one program's way of tracking goals is extremely different from another program's way of tracking goals. So one way to simplify that information then for reporting purposes is to standardize those forms. We've got a ton of forms that are already available within our template library, built out, ready to be utilized, that include many of our best practices and best practices that we've seen from other partner organizations. And you can easily design those forms as you see fit as well. Couple of points with the simplified reporting. One is required fields. So being able to mandate certain information being tracked within a form. So any field that you see on my intake form here that has an asterisk next to it means that it is required. So if I have not filled out pronouns, it is not going to allow me to move forward with saving this document. You can see here, it's going to tell me which of the record save checklist fields have still not been filled out. So once I fill that out, then I would be able to move forward with saving this. So required fields is a great way of ensuring that you're tracking the most important information across the system. Now, if you don't want to make something required, like maybe someone doesn't have a driver's license, you can have that not be a required field and then easily run reports on the back end of the system to see anyone who has that information missing. You can also utilize what's called form logic to make fields unrequired or required. So I could have a radio button that says, was social security number available? If I select yes, then that will then become a required field. So form logic is essentially creating if-then statements on the back end of the system. And that is another really great way of standardizing things across the organization. So here, if I have that they have a social worker listed and I select yes, then some additional fields are going to populate here that I then need to fill out. So that's another way of standardizing that sort of thing for simplified reporting so that you're not making a huge giant form with information that's not pertinent to a specific program, maybe. Because if a client, especially if they log in and look at that front-facing intake form, and it's got 150 questions, 50 of which don't even pertain to their specific need, they're probably not going to fill it out. So the form logic is a great way of making those forms a little bit more streamlined for even data intake as well. So you could have them select which program they're interested in, and an entirely new section could pop up, similar to how my job placement form is created. So if I select on the drop down full-time employment, an entirely new section of this form is going to pop up and have me fill out additional information. So that can be utilized for both internal staff and for those front-facing forms as well. One other way that we see form logic utilized very frequently is with assessment functionality. So basically giving staff prompts based on scores. So with my Arizona matrix here, all of these questions have corresponding point values on the back end of the system. So if I were to hard scroll to the bottom here, you can see that not only is it auto tallying up my score, but the form logic is also giving me recommendations based on the questions that I've answered in the total score. So they have a less than adequate employment. It's going to prompt me to refer them out to our jobs program. But if I were to hard scroll back up to the top here and answer that they had valid employment, but low housing, can scroll down here and say that they're in need of stable housing, but that employment suggestion is going to disappear. So not only does it standardize things for reporting purposes, but then it also makes it really easy for staff to know the workflow process. So what needs to happen next? What sort of cadence of meetings do we need with this given client based on previous questions that they've answered? All of that within the forms is really easy to create as well. So on the back end admin side of the system, it's all done through really simple drag and drop functionality. So whether I'm adding a new required field, like maybe I have a new funder that's requiring me to track veteran status, I can pull in a radio button here, enter in my field choices, and then make this a required field. And as soon as I save and publish this out, now that question will be existing within my intake form for the future. So you can come in here and make those changes at any point, make fields required or unrequired, or even set up that form logic on the back end. So that when you're then going to design the reports, you know that that information is being captured in the same way across every program and across all of your staff. Last piece of functionality that I want to highlight today is the reporting tools. So increasing staff capacity by offloading some of that data entry to your participants and simplifying and streamlining how that data is captured is great. But then we want to be able to actually prove those impacts to the funders or to board members or any external stakeholders that you're talking about. So securing more funding is the goal. All of this information is then reportable through both of our different reporting tools. So last thing that I want to talk about today is those two different reporting tools and how they're going to allow you to secure more funding by telling the story of your organization. So it's really great to be able to count how many services you've provided, but really getting into more of the outcomes sharing is something that's very important for reporting purposes. So first, I want to talk about the native reporting tool. This is the reporting tool built into the impact management system. These reports can be highlighted on your dashboards page, like I showed earlier. They're auto updating, and as long as you have permissions to view them, they're front and center when you log in on a daily basis. Any reports that you maybe don't need to access on a daily basis, or any reports that you want to slightly manipulate, can be run through the My Reporting menu over here. The great thing about these reports is that they're meant to be very high level. So something like this demographics report spans the history of my organization. Every client I've ever served, broken down by gender, age group, race, ethnicity, etc. But even if I don't have the admin privileges to create new reports from scratch, I do have the ability to filter them down. So whether I wanted to see demographic information just for a specific time period, or maybe a subset of demographics, like I want to see racial breakdown, but I only want to see it for my female identifying clients. I can apply a filter to this that will only affect my copy of this report. So if I'm using it for internal purposes, it's not going to affect everyone else's copy. But if I am using it for external purposes, it's also very easy to get the data out of the system as well. So if you're in charge of reporting out to funders within your organization, just think about how much that filtering functionality would help in your day-to-day basis. Say you have to do a monthly report for funders. Instead of having to build that report from scratch each month, all you have to do is plug in the date range that you want to see the information for, and it spits it out automatically. Depending on how your funders want to receive these reports, it's very flexible in terms of that as well. If they just want it in raw CSV or Excel format, you can easily export this data via Excel CSV. You can print these reports directly from the system, or even take out just the visuals as a PNG or JPEG if you wanted it to be published in your website or annual report or something like that. So obviously demographics is a very simple example, but you can run reports on pretty much anything that you're collecting data on, whether it's those reminder reports, participant goals broken out by the participants themselves, or even using this for staff management as well, where I can see all of my staff and the goals that they've set with the participants that they're working with. So very helpful for internal reporting purposes as well, and starting to tell that story not only externally, but internally within your system as well. I always love coming back to this client story over time that relates to the Arizona matrix, where I can see average scores of participants over time versus one individual. Think just how powerful just this one basic visual report would be for telling that client story to themselves. So actually being able to show them the progress that they're making over time and encouraging them to come back and keep participating in programs. So not only being able to prove those outcomes externally, but internally to your staff and constituents as well. I want to end today by talking about the other reporting tool that comes exclusively with our enterprise impact management solution, which is what we're looking at today, and that's the results reporting tool. This is a separate reporting tool that's built on an SAP Webby backend, but still requires no knowledge of coding. I was joking with an organization earlier this week that I have a degree in communications and government, not a computer science degree. So if I could figure out how to work this system and the reporting tools, then pretty much anyone within a nonprofit organization would also be able to figure it out. The advanced reporting tool is more commonly used for things like funder reports, mailing letters and labels, or complex dashboard reports like you see with this CQI model here. One of the main differences between this reporting tool and the native reports is how configurable these reports are. So the visuals you can really manipulate a lot more than sort of the standardized visuals within the native reporting tool, which is why a lot of organizations will use this for their funder reporting, because they can get the data that their funders are looking for in the exact formats that they're wanting it in. Whether it's a dashboards report like this or more of a case profile, This is looking at a client, basically a snapshot of them at one point in time, where I'm pulling in information from their intake form, but also their case plan and service summary as well, to give me a nice holistic view of this client to send out to a funder, to publish in an annual report, or even utilize for internal staff purposes as well. It's also a great tool for more robust changeover time tracking. So this is 8 pages of documentation that tell a story on one particular individual. Changes in things that we're tracking like income, housing, overall self-sufficiency, but also giving us a breakdown of their progress towards their individualized goals and referral statuses and things like that. All of this can be seen on an aggregate basis as well. So these are all the same data points, but across an entire organization or a specific program, or even broken out by caseworker down here at the bottom to see how different case managers' caseloads are measuring up to each other. The other main difference between this reporting tool and the native reports is how staff access these. These reports can actually be auto-generated to send out to staff or any external stakeholders on a frequency that makes sense. So again, if you're the person at your organization in charge of getting those reports out to funders on a quarterly basis, not only are you not going to have to rebuild those reports from scratch every time, but you can also set them up to send out to those funders or to board members on a predetermined cadence. So if you set it up so that it shows up in their inbox on the last day of the quarter, you never have to think about sending it out again. That cadence is determined. It can be utilized for internal staff as well. So if you want your caseworkers to get a case profile updated on all of their assigned participants every Monday morning, this is absolutely something that could show up in their inbox automatically. So I'm going to pause there, just do a quick recap, and then we'll get into answering some of those questions that came in throughout the presentation. So really the 3 main things that we wanted to look at today was how to increase staff capacity through the self-service tools, talking about simplifying reporting by standardizing the way information is captured within a system like this, and then utilizing both of those things through the 2 different reporting tools to then help your organization secure more funding. So like we've been talking about throughout the presentation today, as Ashley mentioned in the beginning, if you are interested in seeing more, this is less than 50% of what I could show on a full demonstration, and a more customized demonstration specifically geared towards your unique use case. Please let us know. We would be happy to provide you with a more customized version of the demonstration. But hopefully this gives you at least a 50,000-foot view and piques your interest in learning more about the impact management system. So I'm going to pause there and then let Ashley go through some of the questions that came in.
Yeah, thank you so much, Chad. This was great. A lot of great insight, a lot of great features to be able to showcase to everyone, especially when it comes to that forms and the logic that can be built in there. That was really interesting to learn more about. And thank you for that segue about kind of having a more personalized one-on-one session. So while we wait for some more questions to come in, want to just launch a quick poll here. Because if you do think that your question is better suited for that one-on-one conversation and are looking for a personalized demonstration, would love to get that insight. And like I said, have one of our colleagues kind of reach out to you and get that set up here. So I'm going to have that launched here. Feel free to fill that out. And while folks go ahead and do that, we did have a question come in, Chad. Sarah is interested in knowing whether or not that Connect service, if that is a separate service from Apricot 360, and if that is the case, if there is an additional charge for using the Connect.
Yeah, that's a great question, Sarah. So no functionality is separate from Apricot 360 in terms of cost. So everything that I showed today and all functionality that anyone would show within the impact management system will come with the enterprise level of the system. So there's no additional cost for utilizing the self-service tools. No additional cost for utilizing the direct message functionality. You can sign up as many of your clients as you want for those Connect profiles with no additional cost. That comes with the enterprise level system.
Awesome. Yeah. And Sarah also had another question come in on whether or not there might be trainings available for folks to learn how to use the funder reporting feature.
Yeah, so there are trainings for pretty much anything within the impact management system. So there's built-in best practices. There's a knowledge base that I always like to plug. This is our access to the live support that you would have. And then also the knowledge base, which is essentially articles and videos on how to do pretty much anything within the Apricot system. But then there are also more like ad hoc trainings that you can purchase. Obviously, you'll go through an implementation process where we'll train you up on the system as well. So it's never the type of thing where we just hand you the keys and say, here, figure it out on your own. There's going to be help all along the way of the process.
Right. Awesome. Yeah. And I had a question here for you, Chad.
Yeah.
Wanted to know, just curious from your perspective, maybe what you think is kind of most valuable to nonprofits when it comes to some of the features you showcased this afternoon when it relates to kind of securing more funding. I have my guess, but I'd love to hear from you, the expert, on what you kind of think is the most valuable, or maybe what you've heard from feedback wise.
Yeah, in terms of securing more funding, it really is the flexibility of those reporting tools. So
Yeah.
a lot of systems have either canned reports or no reporting functionality at all, or reporting functionality that takes staff a lot of time. So with the ability to create those ad hoc reports at your fingertips and then configure those for exactly what your funders are looking for, it's really unmatched in terms of ability to report out on and tell the stories of what you all are looking to demonstrate to funders.
Yeah, that was my guess. That was my guess. Awesome. Yeah. Well, thank you again, Chad. It looks like we don't have
Yeah.
any other outstanding questions, but just wanted to, yes, thank you again for taking this afternoon to present to us. And thank you, everyone here, for your time and your engagement. It's very much appreciated. It was a pleasure to have you all. It was a pleasure to have you, Chad. And we definitely look forward to seeing anyone at our next session. So yeah, thank you so much, Chad. This was super helpful.